I am extremely excited to show you what we have in front of you today. So this is a cadaver that you've probably seen many times. At least you've seen her abdomen. I've shown the uterus down there. We've seen this cadaver in quite a few videos if you've been watching us for a little bit. But what happened was our two amazing interns finished cutting off the chest plate, which means I can now remove this and you can see the internal organs of not just the lower abdominal cavity and pelvic cavity, but also up into the thoracic cavity. So if you're ready, here we go. This is so cool. Look at this. So just give you a real quick tour of what you're seeing here. Here's that greater omentum. And then you can see part of the stomach and then the diaphragm here. But I mean, if I actually peel the omentum back, you can see the stomach curving around and then going up towards there. But we have the diaphragm muscle resting on top of the liver. That's what you're looking at here. Then we can see these amazing healthy lungs. Now, what's really cool is I want to draw your attention to the relationship it has as it's surrounding the heart. And the heart is contained within that pericardium, but you can see the heart is resting on top of the diaphragm. In fact, look at this. They're actually attached. Super, super cool. But you can see that the lungs are pretty much hugging the heart, right? They surround the heart. But these are very healthy, good-looking lungs. You can see the fissure there separating the lobes. But this is just an absolutely outstanding cadaver here. And what I mean by that is a lot of times you're going to see a lot of disease. You're going to see a lot of dysfunction. But here we see a lot of very, very healthy tissues, which just makes this really cool and fun to instruct from.